Lung cancer is the most common cause of cancer deaths in the world, and that's why raising awareness and recognizing the signs of lung cancer are so important. November is Lung Cancer Awareness Month, and joining me is Dr. El-Bakush. Did I say it right?
Yes.
Thank you. I've been practicing and practicing. She's a pulmonologist with Mercy Pulmonology Clinic. Thank you so much for being here today.
Thank you. It's a pleasure. Thank you.
Yeah. So tell us, how does lung cancer affect the lungs?
So lung cancer initially starts at little cells that go divide uncontrolled, unchecked, and then they start forming small masses, and then they grow and grow. And so then early there's no symptoms, but then once they grow, then they start invading other structures, invading the lung, the blood vessels, the airways, and then problems start.
Okay. And are there different types of lung cancer?
Yes. So lung cancer, mainly there's two main types.
Okay.
Non-small cell and small cell lung cancer. Non-small cell is the most common, where there's two types of that one: squamous cell cancer and adenocarcinoma, which is the commonest of all.
Okay.
Then there's some less common cancers like carcinoid tumors, lymphomas, and then pleural tumors, what we call mesothelioma.
Okay. What are the signs and symptoms that people should look for with lung cancer?
When lung cancer starts at an early stage, there's no signs and symptoms, but once signs and symptoms develop, it's a little late. And usually people come with like a cough that persists and doesn't want to go away, or a new cough on top of their old cough, coughing blood, losing weight, shortness of breath, wheezing, chest pain, and then if it spreads, then it starts giving other symptoms elsewhere, like bone pain, headaches, swollen glands, things like that.
Okay. And if people experience those, what's their next course of action?
So if they have any symptoms concerning, they should seek medical advice from their healthcare provider, and then depending on what they're complaining of and their symptoms, they'll have workup that's appropriate.
Okay. Now, we know that smoking is one cause of lung cancer. What are some other causes of lung cancer?
So I divide them into non-modifiable risk factors, so things we can't change. So like age, genetic susceptibility, and then the modifiable ones is the ones that we can change. So the most important is smoking. About 80 to 90% of lung cancers are directly related to tobacco.
Oh, wow. Okay.
And that could be cigarettes, pipes, cigars, and other types. And then there's other things like radiation exposure, radon, asbestos, and some pollution.
Okay. Now, I know, like you said, asbestos, and I think a lot of people were exposed to that because for a long time it was a fire retardant, you know, so it was all over buildings. So
we didn't know.
Right, we didn't know. So I think a lot of people should think about that. They think, well, I never smoked, so there's no chance I'm going to get lung cancer, but that's not necessarily the case.
There's about 20% of lung cancer that come and did not have any history of smoking, unfortunately.
Wow. Yeah. So when people seek treatment, what are some of the treatment options that are available? Are they all really intense, like we kind of assume they're going to be? Or are there other treatment options?
Sure. So the earlier that we detect lung cancer, there's going to be an aim for cure.
Okay.
The later it is, sometimes the treatment is palliative, so to prolong life, to kind of slow the growth of lung cancer and relieve symptoms. And the treatments include surgery, chemotherapy, radiation, and immune therapy.
Okay.
And some patients can receive just one, and some patients need to receive more than one.
Okay. And what are ways that people actually can decrease their chances of getting lung cancer, aside from not smoking?
Right.
Yeah.
The main thing is quitting smoking, trying not to be around any secondhand smoke. Some risk factors like radon, you could check your house for radon and mitigate that. And then the most important thing that we all stress about is, if we detect cancer early, then there's an aim for cure, and it has shown that when you screen people and you detect it early, then you can save lives. And so lung cancer screening is very important, and this is a good month to raise awareness about it. Screening starts at age 50. Guidelines recommend until age 80. Anybody who smoked, we call 20-pack years, which means smoking a pack a day for 20 years, half a pack a day for 40 years, for example. We kind of do that calculation. And then if they still smoke or quit within 15 years, they're eligible. Most insurance pay for it. It's a low-dose CT to detect early lesions that we think might be cancer, and then we follow from there.
Okay.
Mercy, it's available at Mercy. It's also available at other hospitals. And it's if anybody's eligible, surprisingly, when you look at the national numbers, people who are eligible, there's only 6% screened, so we have a lot of more room to improve our early detection of lung cancer.
Yes, absolutely. I think a lot of people too were exposed to a lot of secondhand smoke when they were younger, like if they were out in clubs or bars and there was smoke everywhere before smoking bans went in, so they should probably take that into consideration as well when because that's almost the same, isn't it?
Unfortunately, there's no way of quantifying secondhand smoke, so those patients are not eligible for screening. It was based on these big studies that have been done, and then the people who were included were that smoked or still smoke, and they have to have a certain amount. So unfortunately, yes, secondhand smoke is a risk.
Okay.
But there's no way of quantifying it, and until now,
Okay.
there's no way of screening those people.
Okay. All right. Thank you so much for being here. I think lung cancer is, you know, we said it's the #1 killer.
Right. It's the #1 cancer killer in the United States and in the world. Yes.
Okay. So it's important to take care of your lungs.
Yep.
Thank you so much for being here today. I really appreciate it.
You're welcome.
Yeah,
Thank you.
thank you.
We appreciate it.